province in Canada and know that you'll get the same quality of service and you have the same right to this service will be gone. And the jewel in our crown, of our Social Security crown, will be gone perhaps forever. So we have a huge fight on our hands, and it's a recurring theme. I think every generation has to come back and fight for these programs and for health care, but I think it's a particularly crucial and critical one at this moment. And so I think it's important that we not be reactionary, but rather that we start talking about our narrative, and we talk about a narrative that will replace the narrative that they're putting out, which of course is that our healthcare system is not sustainable. As Mike said, it is extremely sustainable. Public costs as a percentage of our GDP have remained remarkably steady over the last decades. The issue has been rising drug costs and rising private services. And so we have to say that Canadians need universal, comprehensive health care from the cradle to the grave. That the 2014 Accord must not only not be weakened, but must protect, strengthen, and extend Medicare. We must hold firm, to a new full 10-year accord with escalating transfers of 6% for the duration. We need a commitment to enforce the Canada Health Act, no user fees, no private services, no extra billing, and we must put the case to the Canadian people for a national pharmacare strategy. The 2004 Accord was supposed to deliver a program to bring catastrophic drug coverage to Canadians, but it never materialized. A national pharmacare system would save governments over $10 billion a year by bulk buying prescriptions across the country. And we need a plan for continuing care. Lack of care for seniors and home care is a growing crisis. A real national program will provide alternatives that are both less costly and more humane than hospitalization for seniors. And without a full federal, provincial, territorial accord, will the funding for First Nations fall between the cracks? Healthcare on Aboriginal communities in Canada is still often shockingly substandard. The 2014 Accord must deal with this injustice. And finally, we need to make a firm commitment to take healthcare out of trade agreements and not allow healthcare to be placed into any future trade agreements. And you should know that the trade agreement with Europe, the CETA that I talked about, has the same provisions for corporations to sue governments, but this time governments of all level in Canada, if any of them change their minds after privatizing, allowing competition, and then saying that was a mistake. Every generation has had to fight for Medicare, and we owe it to those who came before us and those who will come after us not to let it go on our watch. Healthcare is a fundamental right and a public good for which no financial barriers must be erected. Canadians have fought for this right, and it cannot be taken away from us on an ideological whim. We need a full commitment from the federal government to assume its historic responsibility in setting national standards that guarantee universal, comprehensive coverage to all Canadians. Nothing less than this will do. These are our rights and demands. And no one, not even Stephen Harper, has the right to unilaterally destroy our healthcare system. He should remember and we should remind him that if you take the people who did not vote for him and the people who did not vote for at all in the last federal election, only 25% of Canadians elected Stephen Harper. And yet, because of our system, which is flawed and we all know it, we have this situation of his false majority. So we need to remember and take heart from the original fight for Medicare, which was ferocious. People lost their homes and their farms to pay for health care. When they moved from one province to another, they often had to live there for a year before they could apply for any kind of insurance. Half the young men called up for service in 1939 were rejected because of poor health care. Can you imagine such a thing in today's world? Life Before Medicare is a book that was put out by a group of seniors in Ontario, and they tell stories of what health care, a lack of health care was like in the years before Medicare. One remembers a young mother dying on the steps of a hospital in Grand Prairie while her husband was outside begging for them to take her in. Another remembers a young Ontario mother who had to sell her 2 cows to pay for the hospital so her dead baby's body could be released to her, and they would not release the child until she could find the money. A Manitoba senior recalls a neighboring farm woman who was diagnosed with cancer. She knew that in order to get treatment in hospital, her family would have to sell the family farm, so she decided to die at home. When her husband went out to work in the fields, she had him close all the windows so the neighbors wouldn't hear her cries of pain, and lock the doors from the outside to stop them running for help. Her suffering lasted for 2 months, but she saved the family farm. When Tommy Douglas decided to bring in public insurance in Saskatchewan, he faced the private insurance industry, the Canadian Medical Association, the American Medical Association, and the Saskatchewan College of Physicians and Surgeons, who went on strike. To meet the healthcare needs of the people, a coalition of farmers, unions, and healthcare workers set up 27 healthcare cooperatives that still exist in Saskatchewan to this day. They brought in doctors from Great Britain, including 2 women doctors. Dr. Joan Whitney and Dr. Margaret Maude had to be escorted to work because they received regular death threats. The strike was reported all over the world. Of Tommy Douglas, the Vancouver Sun said, "This man, Tommy Douglas, is, well, a good deed in a naughty world. He is a breath of clear prairie air in a stifling climate of payola and chicanery and double talk and pretense." Medicare is our way of sharing for survival. Our ancestors came here, they found a harsh geography, they settled mostly along that Canada-US border, and we knew that if we didn't share with one another and create ribbons of interdependence, that we would not exist. And that's what the CBC was. Graham Spry, the father of the CBC, used to say the state or the United States to describe why we had to have a national broadcasting system. At that time, it was just radio. But we built ribbons of railways and an airline and a public broadcasting system, and supported public Canadian publishers. And the last one, McClellan and Stewart, has just gone down, taken by a big company called Random House, which is in turn owned by Bertelsmann from Germany. So back to my CETA concerns, right? But these ribbons of interdependence included our social programs, and we have seen them eaten away or destroyed completely, one after another. And I remember when the first free trade agreement was ratified and we started documenting, this is pre-NAFTA, I kept saying to people, somebody should be writing a book about this. This is just a terrible story. Look what's happening to our energy. We've lost control. Look what's happening to our social programs. I started documenting, and I said to a friend, I even know what it's going to be called, or somebody should write a book that's called A Parcel of Rogues, after Rabbie Burns's poem about the people in Scotland who sold Scotland out. And the poem goes, British steel we could disdain, but British gold has been our bane. What a parcel of rogues in a nation. So the rogues are the people in Scotland who sold that country out. So I even thought, somebody has to write this book. And people said, Maude, I think maybe you'll have to do that. And I said, yeah, but I don't write, and I don't know how to type, and I don't have a computer. And so, sat down and poked it out, and the rest was history. But I remember just following the job losses and the change that Brian Mulroney had promised to us, and indeed they have happened. And now we have this Prime Minister coming along and saying, what wasn't finished in that first wave, I'm going to finish now. And we have got to stand up and say no. We have got to stand up and say, we're not patient, we're not going to wait for the next election. We're going to be out on the streets with the occupiers. We're going to be in your face everywhere you go. We are going to say to these premiers, this is not acceptable. You cannot take our healthcare system. It doesn't belong to you. So let us bring some clear Vancouver Island air to this struggle, like Tommy Douglas's clear prairie air, and tell these negotiators and these premiers that the Canadian people fought long and hard for our public healthcare system, and we are not about to give it up. And let us vow tonight to stand on guard for it, lest it be destroyed by stealth and lost in a myriad of betrayals. We owe this to those who fought for generations before us, and we owe it to those who come after us, who have the very same right to public health care that we do. Thank you so much.
The 2014 Health Accord. It's our Medicare system. Have your say. Get involved. Contact Canadians.org or bchealthcoalition.ca.